Bird flu, or avian influenza, is a serious concern for both animal and human health. This viral infection can spread rapidly among bird populations, causing significant economic and ecological impacts. The virus can also jump from birds to humans, posing a potential public health threat. It is caused by influenza A viruses, which are known for their ability to mutate and adapt quickly. These viruses have a segmented RNA genome, allowing them to reassort and create new viral strains. These viruses naturally circulate among wild aquatic birds, which serve as their primary reservoir. Wild birds often carry the virus without showing symptoms, making it difficult to detect and control. Bird flu viruses are classified into two categories: low pathogenic or LPAI and highly pathogenic or HPAI. LPAI viruses generally cause mild or no symptoms in birds, but they can mutate into HPAI strains, which are much more dangerous. LPAI viruses typically cause mild or no symptoms in birds. These mild strains can circulate undetected in bird populations, posing a hidden risk. HPAI viruses, on the other hand, can cause severe illness and high death rates in birds. Outbreaks of HPAI can lead to devastating losses in poultry farms, requiring culling of entire flocks to prevent further spread. Bird flu viruses possess a remarkable ability to change or mutate. This genetic flexibility allows them to evade immune responses and adapt to new hosts, including humans. This makes them unpredictable and potentially dangerous. The constant evolution of these viruses means that new, more virulent strains can emerge at any time, posing a continuous threat. New strains can emerge, and existing ones can gain new characteristics. This ongoing evolution requires vigilant monitoring and rapid response to contain outbreaks. This constant evolution underscores the importance of ongoing surveillance and research. Scientists and health professionals must work together to track the virus, develop vaccines, and implement control measures to protect both animal and human health. A bird flu spreads easily among birds, particularly in crowded conditions. Transmission occurs through direct contact with infected birds. It also occurs through their droppings or contaminated surfaces like water and feed. Infected birds can shed the virus in their saliva, nasal secretions, and feces. The impact of bird flu on poultry farms can be devastating. HPAI viruses can quickly sweep through flocks, causing high mortality rates. This leads to significant economic losses for farmers. It can also disrupt food supply chains, leading to shortages and price hikes. Bird flu outbreaks have occurred periodically throughout history, reminding us of its persistent threat. These outbreaks serve as stark reminders of the delicate balance between humans and nature. The viruses that cause bird flu can mutate and adapt, posing significant challenges to public health systems worldwide. One notable example is the 1918 Spanish flu pandemic. This pandemic was one of the deadliest in human history, causing widespread devastation and altering the course of the 20th century. This pandemic was caused by an H1N1 virus. The H1N1 virus was highly contagious and spread rapidly across the globe, infecting a third of the world's population. It is believed to have originated from birds. The transmission from birds to humans marked a significant event in the history of pandemics, highlighting the zoonotic nature of many infectious diseases. The Spanish flu infected an estimated 500 million people worldwide, resulting in millions of deaths. The sheer scale of this pandemic overwhelmed healthcare systems and led to significant social and economic disruptions. More recently, the world experienced the H5N1 bird flu outbreak in 2003. This outbreak was a stark reminder that bird flu viruses continue to pose a threat to global health. This outbreak highlighted the potential for bird flu viruses to jump from birds to humans. The H5N1 virus was particularly concerning because of its ability to cause severe disease in humans. The H5N1 virus caused severe illness in humans with a high mortality rate. The high fatality rate underscored the need for vigilant monitoring and rapid response to emerging infectious diseases. Fortunately, it did not spread easily between people. This limited its impact, but the threat of a future pandemic remains. Continuous research, surveillance, and preparedness are essential to mitigate the risks posed by bird flu and other zoonotic diseases. In a concerning development, a new strain of bird flu, variant D1.1, has been detected in Nevada. This strain, a type of H5N1, was first identified in dairy cows. It has raised alarm bells among health officials. This is the first time this particular strain has been found in cattle in the United States. The discovery of this new strain has prompted swift action from authorities. Affected farms have been quarantined. Surveillance efforts have been intensified to track the virus's spread. The situation is being closely monitored by state and federal agencies. While bird flu primarily affects birds, it can spread to humans through close contact with infected birds or their contaminated environments. Direct contact with infected birds, their droppings or contaminated surfaces poses the highest risk. Airborne transmission is also possible, though less common. This can occur when the virus becomes aerosolized, such as during poultry processing. It is important to note that human-to-human transmission of bird flu is rare, and sustained spread among humans has not been reported for this strain. Section 6, at-risk populations. Who should be most concerned? While the general public is considered at low risk, certain groups are more vulnerable to bird flu infection. People who work in close contact with poultry, such as farm workers and poultry processors, face a higher risk of exposure. Veterinarians and wildlife officials who handle birds are also at increased risk. Individuals with weakened immune systems, such as those with chronic illnesses or undergoing chemotherapy, are more susceptible to severe complications from bird flu. Pregnant women are also considered a high-risk group. Section 7. Assessing the threat, infectiousness, severity, and mutation. The emergence of the D1.1 strain in Nevada raises several concerns. This new strain has caught the attention of virologists and epidemiologists worldwide due to its unique characteristics and potential impact on both animal and human health. Understanding its behavior is crucial for developing effective containment and treatment strategies. First, its ability to infect cattle is worrisome. Cattle are a significant part of the agricultural industry, and an outbreak among these animals could have devastating economic consequences. Moreover, the virus's presence in cattle could facilitate its spread to other species, including humans. This could potentially create a new animal reservoir for the virus, making control more challenging. Animal reservoirs can serve as ongoing sources of infection, complicating efforts to eradicate the virus. Enhanced biosecurity measures are essential to prevent cross-species transmission. Second, the severity of this strain in humans is still being assessed. Initial reports indicate that the D1.1 strain may cause more severe symptoms compared to previous strains. This has led to increased hospitalizations and a higher demand for intensive care units. Early data suggests it can cause severe illness, as evidenced by a human case in Louisiana. The patient exhibited acute respiratory distress and required prolonged hospitalization. This case highlights the need for ongoing surveillance and research to fully understand the strain's impact on human health. Lastly, the virus's mutation potential is a constant worry. Viruses are known for their ability to mutate rapidly, which can lead to the emergence of new variants with different properties. These mutations can affect the virus's transmissibility, virulence, and resistance to existing treatments or vaccines. Viruses can mutate rapidly, potentially increasing their ability to spread or cause severe disease. Continuous monitoring and genetic sequencing of the virus are essential to detect and respond to these changes promptly. By staying vigilant, we can better prepare for and mitigate the impact of future outbreaks. Section 8. Staying safe. Practical steps for prevention. While the threat of bird flu is real, individuals can take practical steps to protect themselves. Avoiding contact with wild birds, especially sick or dead ones, is crucial. Poultry and eggs should always be cooked thoroughly to kill any potential virus. Good hand hygiene, including frequent hand washing with soap and water, is essential. Staying informed about bird flu developments and following guidance from health officials is critical. Travelers to areas with known bird flu outbreaks should take extra precautions. Section 9. Expert opinions, the importance of vigilance. Health experts emphasize the importance of early detection and prevention in controlling bird flu outbreaks. The Centers for Disease Control and Prevention and the World Health Organization are closely monitoring the situation. The CDC continues to work with state and local partners to investigate outbreaks and develop effective control strategies. Ongoing research is crucial to understanding the virus's behavior, developing vaccines, and improving treatment options. By staying vigilant, informed, and prepared, we can mitigate the risks posed by bird flu and protect both human and animal health.